Hi, everyone. Good morning. I'm Dominick Kennerson, the global head of G4A at Bayer. I'm based here in Berlin, Germany. It's really a pleasure to be here with all of you at Giant Health. I will share with you some policy approaches related to artificial intelligence in healthcare, which is a really big and important topic. I'll do that at least through about five different buckets. We have 30 minutes. I'm not sure if I will take all of that time. It depends on how my water right here does. But those different buckets will be around the major ecosystem drivers and trends. Some of the developments that we've seen, of course, I have to provide some context for Germany and Germany's context for digital health and artificial intelligence. Then I'll provide some kind of AI considerations, and I'll talk a little bit about G4A. I'd be a bit remiss if I didn't talk a little bit about my background and why this topic is interesting for me. So I've been in digital health, was introduced to digital health and digital health work about 15 years ago. I've seen the entire digital health landscape change a lot over that time. AI, I think, represents a lot of the future, and I really became connected to this topic in my work before G4A at Bayer, which was really supporting our health policy team um, here in Berlin. So with that, some of the major ecosystem drivers and trends. So artificial intelligence inside, and maybe for definition purposes, when I say artificial intelligence, I don't necessarily mean true artificial intelligence. I am also, for the purposes of this presentation, talking about machine learning. Excuse me, I'm also talking about those building blocks that make artificial intelligence and machine learning capable, so data. So this presentation may go, I think, a bit through those different channels. I will also provide some context as relates to the work that we do at G4A, the work that we do with digital health companies, startups, or more advanced companies, as well as kind of the traditional biopharmaceutical approach, which is actually a bit different than what we do at G4A. So at G4A, what we do and how we think about health and healthcare is really first through the lens of social determinants of health. Social determinants of health essentially means everything in your environment that influences your health and healthcare. I think that definition could be broken down a little bit further if you were to take into consideration the World Health Organization definition for health and what that means in terms of complete um, uh, mental wellness and wholeness and being. So part of the science behind social determinants of health is also related to the number one predictor of your health status, which is really um, where you live. So I think zip code is one of the number one predictors on how healthy someone is. What we saw pre-COVID was already this artificial intelligence spring. I think what a lot of people miss in the artificial intelligence conversation is that artificial intelligence in healthcare has been around for at least 30 years. It is said to go through different periods of springs and falls, so to say. Already pre COVID, we had a changing and shaping public policy and regulatory environment. Um, what we also saw, and I think what's important for just kind of broad digital health considerations, is the additional lenses that we look through and that we consider at G4A. So NCDs, population aging and healthy aging. And then I think pre-COVID, a lot of the conversation when it came to finance around healthcare was about sustainability. And really, what that conversation was about was limiting healthcare spending. What we saw post-COVID, or I think still in COVID a bit, was that yes, these ecosystem trends were really, I think, became major proof points with the COVID layers, so to say, added to it. So if you had an NCD, you were at an increased risk for COVID. If you are older, I think this has changed a little bit now, but you were at an increased risk for COVID. The conversation around healthcare spending has been much more around investing, and we've seen that kind of play out in the digital health marketplace significantly and in very quantifiable metrics. I think there are also some qualitative metrics. So, for example, I saw yesterday, a company like Pfizer raised like 50 points in a consumer survey on, brand identities and how people feel about brands. Um, but just for the purposes of today, I will mostly focus on these two pillars, artificial intelligence spring and public policy and regulatory environment. So this is the part in the presentation where the official um, acronym soup kind of begins. So for purposes of definition, WIPO, the World Intellectual Property Organization, USPTO, the United States Patent and Trademark Organization. Those are at least terms that you should be familiar with. So if I just say WIPO or USPTO, you know what I'm talking about. So in my work at Bayer, and Bayer being a global biopharmaceutical company, it's no secret that intellectual property is very important to us and to other biopharmaceutical companies. It's said to be the lifeblood of the industry. And we, I think, even see this in some headlines today. So when I entered into the AI conversation, it was really through the intellectual property lens. And part of that was really encouraged through the WIPO AI conversation. It says here 2019, but a lot of the framework for that conversation began as early as 2018. That conversation, I think, is highly important because as a multilateral organization, WIPO is in the position to really bring in countries, um, uh, very large countries like the United States, as well as smaller countries, um, low middle income countries, low income countries, all to debate, define, outline what's important in terms of artificial intelligence as it relates to intellectual property. The US Patent and Trademark Office, not to be outdone, issued its own public consultation also in 2019. This process I'm probably most familiar with, in part because my work at that time was focused on public affairs and healthcare policy in the United States. I was also a part of a group of one of our trade associations, Pharma PHRMA, based in Washington, D.C., that focuses solely on intellectual property. But what we learned through this USPTO conversation is that the USPTO was asking very big questions, and they were asking those questions not only to US stakeholders. So, for example, in 2019, the head of the patent office, Andre Iancu, actually came to Europe. He spent some time in Brussels. He also spent some time in Germany in Munich, and part of his agenda was really to build transatlantic conversation around the topic of artificial intelligence, its definitions, its uses, and really part of that conversation was about how to have a partner or how can Europe partner with the US on building strong artificial intelligence capabilities, especially against potential threats. What we've seen, I think, since WIPO has continued its work in 2019 as well as 2020, and that work continues in 2021. So the World Intellectual Property Organization, I think they've now had about three different sessions where they have brought in people. The most recent session, they've brought in companies as well as governments to really drill down on some of the topics and use cases and issues, whether they're related to design, copyright, everything kind of related to intellectual property, not just patent ownership, which was, I think, the key component of the USPTO framework for artificial intelligence. What we've seen really from the European Commission, and I think throughout this, and I maybe saved Europe a bit for last, is the cherry on top in our acronym soup, is the fact that the European Commission has had or has, I think, one of the most, I won't call it aggressive, but systematic approaches to developing capacity and framework for artificial intelligence. So through the EU Commission proposal for AI regulation, essentially um, Europe is positioning for the first legal artificial intelligence framework in the world. And I'll talk about that a little bit later in some of its really distinct components. So, as a biopharmaceutical company, and as we think about artificial intelligence, I think it's easy for people to conceptualize a bit. Okay, so how would a company like Bayer think about artificial intelligence? And so I essentially have this here a bit for illustrative purposes, and I will show you why this is mostly illustrative a bit later. But we see the key takeaway on the slide is really the fact that artificial intelligence exists across the entire value chain uh, for a biopharmaceutical company. This applies to biopharmaceutical companies as well as new healthcare startups that are developing. Of course, their value chain looks different, but it's still there. Um, but in this biopharmaceutical value chain, and I borrowed this layer from one of our trade industry associations, IFPMA, they have kind of an illustrative example that talks about just three major buckets for the value chain, being drug manufacturing, distribution, and dispensing. So in drug manufacturing, and we have examples like data mining, understanding disease, um, drug candidate generation and selection. For distribution, of course, supply chain management, supply chain planning, inventory management, forecasting, tracking, dispensing, clinical decision support, diagnostics, patient monitoring, and digital therapeutics. If you have a very keen digital health or med tech eye, you probably noticed that some of these in this last bucket probably aren't traditional biopharma. So I'll explain some of those a bit later. I should also say that their this value chain, is absolutely, I think, a bit more connected than these three different buckets. Um, so again, consider this a bit illustrative. But as a jump off point, maybe we'll talk a little bit more about digital therapeutics, especially as it relates to what we see in Germany. The other value chain is a little bit the digital health value chain. So in the previous slide, we saw the biopharmaceutical value chain and what that looks like. For G4A and the space that we focus in is really digital health, and we see artificial intelligence and machine learning really driving that value chain also. That value chain is comprised of digital therapeutics, diagnostics, patient monitoring, of course, healthcare provider engagement, drug development, and business decision support, some of which also apply to the previous slide in the biopharmaceutical value chain that you saw. Um, I think what's an important takeaway on this slide is also the fact I think that digital therapeutics occupy a very special space philosophically for biopharmaceutical companies in the sense that we're talking about therapeutics. I think also from a commercial and business aspect in the sense that now the majority of digital therapeutics are considered prescriptions or are prescription digital therapeutics. And I think this is a trend that is really only going to continue. And it's a space that companies like ours have to pay attention to and be involved in. And we have seen, and probably most of you have seen, that, I mean, if something isn't powered by AI or machine learning today, then it almost doesn't exist. Germany. So Germany, everything on the slide is about Germany except for the lower left quadrant. Um, but I put this lower left quadrant in scope a little bit to talk about some of the venture financing and money that we see in the digital health marketplace. But Germany is really, for lack of better words, and especially since Jens Spahn took over as health minister, has taken a major step forward uh, for digital health and digitalization. What we've really seen are a number of factors, and these factors, I think, aren't solely respective to Germany, but could be applied to many other countries. But what really stands out around Germany is the government support around the DiGA, or the digital therapeutic reimbursement mechanism that Germany has created. Germany is also a really interesting testing ground as it relates to artificial intelligence. So not only this regulatory reimbursement mechanism, but the fact that Germany has or is known for having global thought leaders on the topic of artificial intelligence. I think over the last year, people have become more comfortable with using mobile applications in the country as well. And of course, here in Berlin, we have a bit of a startup hub for Europe, and that trend is continuing. Um, what I will say about this lower left quadrant, I mean, I probably could have put in the 2020 numbers and where we are in 2021. The fact of the matter is that really the 67 billion for in 2025, we're probably gonna, based on this year alone, we're probably gonna blow right past that. Just to put that in scope, Germany, I think for 2020 was somewhere circa 250 million euro in digital health funding. Um, so, I mean, I think I don't want to say that could be broken down on a per capita basis, but if one were to do a country to country comparison on digital health funding, something like that could be interesting. Where we do see a lot of that funding going are in those NCD areas that I mentioned earlier, so heart failure, diabetes, and hypertension. This is a slide that's borrowed a little bit from our friends at Roland Berger. And I saw this slide sometime last year and thought it was hugely interesting because all of a sudden Germany was at least on par with the United States. And this gets a little bit back to that per capita digital healthcare spend. So, I think 2019 digital health spend in the US was somewhere close to, depending on how you count it, somewhere around actually that 7 billion. Um, and so with Germany being less than a billion, I think that would be more of an apples to apples comparison in terms of value. But outside of that, what we really think about are the different frameworks. So the US FDA, of course, a lot of people look to Germany and the reimbursement fast track for digital therapeutics. We get a number of questions, calls, emails about that quite consistently. I think in the fast follower category, you will see a number of countries from the European Union. And then the follower category, I think you'll see those as well. Um, Throughout here, I mean, I think anytime you see digital therapeutics, for me, the natural trigger is that, okay, there's a really strong chance that this is not even strong, but a 99% chance that it's AI driven or using some form of machine learning, whether it's a novel kind of an algorithm or something out of a box that's being used. And so, kind of with, I think, in terms of representation, Europe, maybe I'll can talk a bit about Europe. So, in terms of some of the data structures and the pathways that we're seeing, of course, we're all familiar now with GDPR, the Schrems 2 Act and ruling from last year. I'll talk a little bit about the European health data space, Gaia X, and most importantly, I think this EU Commission around AI regulation and this initial legal framework. Um, Key takeaways: GDPR, everyone knows by now. It's about personal data and protecting that data for health. Um, it only applies if consent is given. For some companies, especially US-based companies or companies outside of Europe, digital health companies that are looking to scale, GDPR is really important to know about. Um, Many, I think, entrepreneurs that are starting businesses are still becoming familiar with GDPR and its impact to their business, especially any potential administrative burden that they have to think about. For Shrims, I think this is also important. And for me, this is a hugely important topic, especially as it relates to the early digital health ecosystem and the scalability of that system. Essentially, because what this means is unless you have a subsidiary or a place to store your data in Europe, you have to almost build a separate, distinct business or have um, uh, kind of a really physical footprint in your to-do business. And to me, that's a bit of a challenge and a bit of a market access and entry barrier. If we think about where things are going, so the European health data spaces primarily supported on three main pillars for strong data management, high data quality, and strong infrastructure and interoperability. To me, I think the European health data space is still a bit theoretical because even if we look at just one of these pillars around high data quality, this to me is one of those topics that's really difficult to address because I mean, almost no one has a complete patient record, right? So how do you really validate the quality of that data? But this is, I think, its goal and one of the challenges that it has to address. The real benefit is the fact that if that data quality aspect can be addressed, then you do have data that can be scaled and really begin to support public good and create new relationships for business. Gaia X, which many of the Gaia X projects are actually based in Germany and Berlin. This is essentially the networked European data infrastructure, so an open source digital ecosystem where everyone kind of agrees to certain principles. Um, of course, it promises secure data exchange, interconnection, decentralized data servers. Um, And then we have the AI regulation, which is where I really wanted to focus. So the AI regulation is really built on two principles. One is supporting the benefits for artificial intelligence. The other half of that is minimizing the risk. So the benefit profile is really directed for citizens, business, and public interest. The risk profile is built on protecting fundamental rights. And I think the way I read some of the regulation is really about human rights. The key regulatory concept is around existing frameworks for internal market legislation. What's new or novel is really this layered risk-based approach that they're taking. And then I mentioned, I think, around Shrimps too, how maybe there wasn't a level playing field, at least through this AI regulation. The language around it suggests that there could be a level playing field for EU and third countries to participate. I think one of the key takeaways for this is this layered risk-based approach. Essentially, what's in that approach, it raises it. There's a scale from unacceptable risk to minimal or no risk. Healthcare is mostly in between. Unacceptable risk includes everything, things like social scoring. There's an example, I think, about subliminal manipulation. So, for example, if a truck driver has some sort of a subliminal mind stimulant to help keep them awake, those kinds of technologies are automatically excluded and unacceptable. What's also important, I think, for companies is that the burden will be on them to determine their AI risk level and where they kind of fall along that scale. And that's essentially what kicks off the CE mark process in the European Union. So I think what's important on this slide is, again, I like value chains for whatever reason, but there are key takeaways. So is that throughout the value chain, there are a number of impact points and considerations. I think some of the considerations for artificial intelligence are hugely around machine readable data sets. I absolutely have to mention that these uh, approaches have to begin to really talk about removing artificial intelligence and machine learning bias. I can highly recommend everyone check out uh, Coded Bias on Netflix if you haven't seen it yet. That will give you a great crash course. And then being able to share data in a safe way, I think, across different geographies is pretty key. Essentially, there has to be a balance between free market principles to enable digital, as well as to support appropriate frameworks for artificial intelligence and machine learning. So, what does that all mean for Bayer and G4A? So, at G4A, our vision is health for all through digital health, and we do that by looking at scalable digital health solutions to create impact, empower lives, and change the experience of health. We essentially exist as a bridge between the digital health ecosystem, people like you, and Bayer. And where we focus is on our early stage investments, and we have an accelerator model. We also have a co-creation, kind of a partnership model as well. We do that, and we're actually part of a group. I've talked a lot about value chain. I think actually my slide after this is another value chain, but what you won't see on this slide is anything about drugs. So we are actually a part of I think, a unique approach in the biopharmaceutical space because we're focused on integrated care. And it says Bayer Integrated Care, but integrated care is not a Bayer label or trademark. Integrated care is really about human behavioral health, well, excuse me, human centered design solutions for health. And for us, this does not involve pills or pill supporting business. So we're looking at coordinated healthcare approaches. So we're looking at scale for people to actually prevent or manage disease. We're looking to reduce inefficiencies in healthcare. And we can kind of see that expressed through a number of ways. I already mentioned prevention, disease management, care management, and there are other kind of digital solutions that support that. So for us, again, another value chain. This is kind of where we play on this right-hand side, you know. So for us as a traditional biopharmaceutical company, we're much more forward-looking and not so much looking at what we've seen from the clinical R&D space, but really, okay, what kind of digital health solutions are people actually connecting to, and what are they connecting to a scale that can actually improve their health and healthcare? So we essentially look for, scout, and partner with companies through these two different partner models. One is our growth track, so for pre Series A kind of companies. The other is our advanced track. We had a company last year, I think, all the way up to Series E. That was part of that advanced track. We normally scout source companies from across the globe. As a matter of fact, if you go to our website now, g4a.health, you click on partnerships, you'll see our 2021 challenges and challenge areas. Last year, for example, we did Scout in women's health, pharmacovigilance, cardiovascular, patient identification, which really means in this case oncology, and quality of life, which is also a bit connected to cardiometabolic disease. Um, and all of our companies that we partnered with in 2020 were essentially powered by AI. In the early space, those examples would be Ellie and Karia. Ellie is essentially an audio companion for chronic disease management, and Karia is one of the few, if not only, digital health platforms for menopause. In our advanced track, there's My On Care, Decipher Biosciences, and Switch. Switch is maybe one of my favorites. It's one of the most intuitive AI-powered engines built on geolocation that can help you figure out your step count, help you stay healthy, help you decide what to eat when you go into a restaurant, etc. So these are just some of the functional ways I think that we experience and work with AI. And I think there are a number of considerations from the policy space that early digital health and med tech companies should essentially be aware of. And with that, I will stop sharing. And I believe the conference people said that you can send questions, and I'll be happy to answer any of those.